Remove the catheter from the package and remove the needle cover and grasp the catheter as shown. Rotate the white safety shield clockwise to loosen the tip seal, keeping the wire stylet straight. After you've loosened the tip seal, inspect the catheter and ensure that the bevel of the needle is facing upward. Make sure the catheter tip is not covering or is too far away from the needle bevel. Now the catheter is ready to be inserted. Grasp the wings and firmly pinch them together. Your finger should be touching the pebbled side of the wings. It's imperative to pinch firmly, otherwise the needle will push back into the catheter when you attempt to penetrate the skin. This situation could cause increased insertion pain for the patient. If it becomes necessary to reorient the needle bevel, relax your grip and twist the safety shield until the bevel is facing upward and firmly pinch the wings again. Apply skin traction to stabilize the vein and prevent it from rolling away from the needle tip. Approach the vein slowly at a low angle and perform the venipuncture. Look for blood return along the extension tubing. Blood return indicates the needle tip is in the vein. To ensure the catheter tip is also within the vein, lower and advance the entire catheter unit forward slightly. Lowering the catheter angle reduces the likelihood of penetrating the posterior wall of the vein. Relax your grip on the wings, position your fingers over the pebbles on the safety shield, and pull back 1/4 to 1/8 of an inch. Now, advance the catheter completely into the vein up to the wings. The needle can now be completely removed. To do this, stabilize the wings flat against the skin. Position your fingers on the center of each wing to secure the catheter. Do not apply pressure over the needle. Keeping the extension tubing straight, grasp the pebbled area firmly on the safety shield and pull back in one continuous motion. As the shield telescopes and releases, it passively encases the needle into the safety shield. At first, this might feel awkward. Keep practicing until you're comfortable with the continuous motion. The shielded needle should be disposed of into a puncture-resistant, leak-proof biohazard sharps container. If for some reason the needle is not shielded after removal, grasp the pebbled end of the white safety shield, allowing the needle to hang downward. The telescoping shield should fall and cover the needle. If the tip is not completely covered, grasp the upper end of the telescoping safety shield and gently push downward, keeping the needle point away from your body at all times. Dispose of the entire unit immediately. Remove the vent plug and connect the IV catheter to a primed IV set or needleless injection cap and secure the catheter according to your facility's policy and procedure. To maintain the correct position of the bevel, grasp the pebbled side of the wings and pinch firmly, locking the needle into position. Inspect the catheter, making sure the catheter has not pushed forward over the needle bevel or is not too far back from it. The following tips will increase your insertion success. Release the tip seal by holding the catheter as shown and rotating the safety shield clockwise. Lower your initial insertion angle so that the catheter is nearly parallel to the surface of the skin. Slow your initial approach to the vein. Reduce the force used to penetrate the skin. With BD catheters, you'll feel a loss of resistance rather than a pop when entering the vein. After visualizing flashback, lower the catheter angle and advance the entire unit forward slightly. Be sure to maintain traction on the skin as you're threading the catheter. To make removal of the needle as easy as possible, follow these simple steps. Open the wings flat against the skin and position your fingers on the center of each wing to secure the catheter. Don't apply pressure over the needle. Keeping the extension tubing straight, firmly grasp the pebbled area on the safety shield and pull back in one continuous motion until the shield pops off.